Hello viewers, welcome to our channel JD Pharmacoveda. In this video, we are going to discuss about the drug Digoxin. So before entering into our topic, let's see a quote written by Huda Katan. He says, "The minute you decide to do what you love to do, you have made a life plan for yourself and a career choice." So decide what you love to do. Digoxin. Digoxin is a medication used to treat various heart conditions. Most frequently, it is used for atrial fibrillation, atrial flutter, and heart failure. Mechanism of action and pharmacological actions. Digoxin's primary mechanism of action involves inhibition of the sodium potassium adenosine triphosphatases mainly present in the myocardium cells, that are heart cells. This inhibition causes an increase in intracellular sodium levels, resulting in decreased activity of sodium calcium exchanger, which normally imports 3 extracellular sodium ions into the cell and transport 1 intracellular calcium ion out of the cell. The reversal of this exchanger, triggered by the increase in intracellular sodium, results in an increase in intracellular calcium concentration that is available to the contractile proteins. Then this calcium concentration lead to the binding to more calcium to troponin C, which results in increased inotropy. Increased intracellular calcium lengthens phase 4 and phase 0 of the cardiac action potential, which leads to a decrease in heart rate. Increased amount of calcium also leads to increased storage of calcium in the sarcoplasmic reticulum, causing a corresponding increase in the release of calcium during each action potential. This leads to increased contractility, that is the force of contraction of the heart without increasing heart energy. Then the inhibition of the sodium pump may also improve baroreceptor sensitivity in heart failure and may explain some of the neurohormonal effects of digoxin. Digoxin also has important parasympathetic effects, particularly on the AV node. While it does increase the magnitude of myocardial contractility, the duration of the contraction is only slightly increased. Its use as an antiarrhythmic drug comes from its direct or indirect parasympathetic stimulating properties. The vagus nerve stimulation slows down the conduction at the AV node by increasing the refractory period of cardiac myocytes. The slowed AV node gives the ventricles more time to fill before contracting. This negative chronotropic effect is synergistic with the direct effect on cardiac pacemaker cells. The arrhythmia itself is not affected, but the pumping function of the heart improves owing to improved filling. Then other electrical effects include a brief initial increase in action potential followed by a decrease as the potassium conductance increases due to increased intracellular amounts of calcium ions. The refractory period of the atria and ventricle is decreased while it increases in SA and AV nodes. A less negative resting membrane potential is made, leading to increased irritability. The conduction velocity increases in the atria but decreases in the AV node. The effect upon Purkinje fibers and ventricle is negligible. Automaticity is also increased in the atria, AV node, Purkinje fibers and ventricles. ECG changes seen in people taking digoxin include increased PR interval and a shortened QT interval. Also, the T wave may be inverted and accompanied by ST depression. It may cause AV junctional rhythm and ectopic beats, resulting in ventricular tachycardia and fibrillation. Adverse effects: the toxicity of digitalis is high, margin of safety is low, so that is therapeutic index is 1.5 to 3. About 25% patients receiving digoxin therapy develop one or other toxic symptoms. The manifestations are extracardiac anorexia, nausea, vomiting, and abdominal pain are usually reported first. Then, due to gastric irritation, mesenteric vasoconstriction, and CTZ stimulation. Diarrhea can also occur. Fatigue, malaise, headache, mental confusion, restlessness, hyperapnea, disorientation, psychosis, and visual disturbances are other complaints. Skin rashes and gynecomastia are rare. Then cardiac effects: almost every type of arrhythmia can be produced by digoxin. Pulsus bigeminus is common. Others are nodal and ventricular extrasystoles, ventricular tachycardia, and ventricular fibrillation. Then partial complete AV block may be the cardiac toxicity. Severe bradycardia, atrial extrasystoles, atrial fibrillation have been noted. Then treatment for these kind of arrhythmias or toxicities. For tachyarrhythmias, when caused by chronic use of digoxin and diuretics, then infuse potassium chloride 20 millimolar per hour IV or give orally in milder doses. Then for ventricular arrhythmias, lidocaine IV repeated as required is the drug of choice. For supraventricular arrhythmias, propranolol may be given IV or orally depending on the urgency. Then for AV block and bradycardia, the treatment of choice is cardiac pacing through a temporary inserted pacemaker and atropine 0.6 to 1.2 milligram IM may help. Then there is an antibody, digoxin antibody. This specific antibody is highly effective in reversing cardiotoxicity due to digoxin as well as many other related glycosides. Then uses: the most common indications for digoxin are atrial fibrillation and atrial flutter with rapid ventricular response, especially in older or less active patients. Through beta blockers or calcium channel blockers may be preferred in some patients such as younger or more active ones. In heart failure, digoxin is a positive inotropic drug which affords symptomatic relief primarily in systolic dysfunction or when congestive heart failure is due to atrial fibrillation with a rapid heart rate. Digoxin induced enhancement of contractility increases ventricular ejection and shifts the curve relating stroke output to filling pressure towards normal so that adequate output may be obtained. Thank you for watching. If you like our video, please like, enter your thoughts in our comment section, share with your friends and subscribe to our channel.